Hello everyone, welcome back. So in our last video, I spoke about loop 2310A, B, C, D, E, F till ambulance drop-off location. And now, uh, I'm not going to go into details of the loop 2320, which is for other subscriber information, but I'm just going to explain you on high level because all the segments and the information that goes out in those segments, everything remains the same. So if you just look at the technical specification, you would understand how to, what is the importance of the other subscriber information. So basically, other subscriber information is nothing but, uh, if you see, the subscriber information goes here, and this subscriber is the subscriber of the policy which belongs to the payer which this claim is going to. So suppose you have Medicare as your primary, and maybe you have secondary insurance from your wife, because your spouse works and she has insurance. And let's take an example, maybe she has United Healthcare, and you're using that United Healthcare as a secondary insurance. So suppose if this claim is going to Medicare, then loop 2000B and 2010BA will have your information because you are the subscriber. Okay, and patient information, it will again be you because you are the patient. But in other subscriber information means that secondary policies subscriber information. So in this case, this will be your spouse's information, her name and her subscriber ID and everything. Now other pair, so similar to the pair that goes here in loop 2010 BB, which is Medicare. In this case, the other pair, which is the secondary pair, will be United Healthcare. Now, I'm going to talk about some situational rules here. So, it is only in case of Medicare, when you're billing to Medicare as primary, you need to send the secondary insurance information out here in loop 23, 20, 23, 30B. And the reason is because Medicare, once Medicare pays the claim, it automatically crosses over the claim to the secondary insurance. And what I mean by that is, so in normal situation, suppose if you have any other insurance other than Medicare, you send the claim to that insurance. That insurance will adjudicate the claim, pay you whatever amount they have to pay you, and when you want to send the claim to the secondary insurance, then it has to be billed again from your revenue cycle management system. So you have to send the claim twice, once to primary and once to secondary. But in case of Medicare, you send the claim to Medicare, they adjudicate the claim, they pay whatever they have to pay you, and then they send this claim to the secondary insurance from their system. So you don't have to bill it again from your system. But this is only in case of Medicare, and that's the reason that when you bill Medicare as primary, you also need to send secondaries information if applicable. And in case you're billing to secondary, like you got payment from primary and you're billing to secondary. Now suppose your secondary is United Healthcare. So in loop 2000B, United Healthcare's information will output. Subscriber is your spouse, so her information will output. And in the other subscriber, so who's the other payer? Because now in this case, you're sending the claim to secondary insurance. So other payer means the one that has already adjudicated this claim. In this case, Medicare, your primary insurance. So that information will go here. So I hope that is clear. And all the segments remain the same, guys. It's NM1 segment, SBR segment, and our N3 and 4 segments for address information. So let's jump to service line information. So service line is basically all the information regarding the procedure codes, the HCPCS or CPT codes. Today we'll look at what information outputs in loop 2400 in detail. So let's jump into it. This is how it looks, guys. It starts from LX, and then this is one is the counter, that means this is the first service line. LX2, that means this is the second service line. LX3 means this is the third service line. LX4 means this is the fourth service line. So let's look at it. And if you see all the elements, so SV1, nothing but service line, just SV, service line. Yeah, service information basically. And HC is the qualifier for HCPCS codes. This is the actual procedure code. 99213 is the office visit code. You can Google it and see. 40 is the total billed amount for this service. UN means units, and this is number of units, how many number of units. So let's look at the technical specification. So it's the same, guys. See, element 1 is a composite element, consists of 8 sub-elements. So the first sub-element of the first element contains HC, which means HCPCS code. The second sub-element contains the actual HCPCS code. In this case, it's 99211. And then the third element contains the modifier, the procedure code modifier. And modifier is something that gives you more information about the procedure code. Example LT, which means left. So suppose dressing of the wound on the hand, okay, and then the modifier will be LT, which means it was left hand. So let's Google it out and let's see what are different types of modifiers. Alright guys, so these are some example of modifiers. Example E1, which says upper left eyelid. So there is some procedure regarding the eye, then this kind of modifiers may be used. Let's look at this. FA, left hand thumb. So as I gave you example that dressing on the wound, but where exactly? So left hand thumb, FA. F1 means left hand second digit, F2 third digit. So these are some modifiers. See, left foot, great toe, but not only limited to the left hand, left leg and left toe and everything. There are more as well. uh, Example, this assistant surgeon. So if there is any surgical procedure, along with that, this 82 modifier can be used if uh, it has been performed by an assistant surgeon when qualified resident surgeon not available. So many more modifiers, guys. You can go through this list. So one service line can have maximum of 4 modifiers. If you see a 3 sub-element, third sub-element, fourth sub-element, fifth sub-element, sixth sub-element. So 4 modifiers for one procedure code. All right, and then next comes the actual total charge amount, second element of SV1 segment, line item charge amount. So whatever amount has been billed for this particular procedure code. And then the third element is unit or basis of measurement code, and it is always UN, which is units. Only in case of anesthesia or anesthesia procedure, it is MJ, which means anesthesia minutes. Okay, let's move ahead. Now the other important thing you guys need to know about is SV107 composite diagnosis code pointer. Seventh element is again a composite element, and it contains of 4 sub elements. So basically what this means is a diagnosis code pointer is why this procedure has been performed. What is the reason that this procedure has been performed? So if you have seen my last videos in loop 2300, in HI segment there can be maximum of 12 diagnosis code, and they are numbered in sequence, like first is the principal diagnosis, then second, third, fourth, fifth, sixth. So why this procedure has been done? The diagnosis pointer is this 1 2 3, which means that the diagnosis that I have sent at first position, second position and third position of the loop 2300 segment HI, those are the diagnoses why this procedure was performed. So I hope that is clear. And EPSDT indicator. So I think we have seen this in loop 2300 as well, but I'll repeat this. EPSDT is early periodic screening, diagnosis and test. This is only required if you're billing Medicaid. So basically this indicator just shows that this procedure that was performed is part of EPSDT program. So Medicaid runs this EPSDT program to avoid any, it is basically screening, like mammography screening. So women above age of 40 has to go through regular mammography screening to prevent any kind of breast cancer. and their age, and this is applicable only to women which are older than 40 years old. So that is one of the EPSDT programs. So just an example basically. All right, let's move ahead. So loop 2400 DTP segment is service date. So date of service basically. So if first element contains 472, which means service date. Second element can contain RD8, so it will have from date and to date. And if it is only D8, then it will just have one service date. So pretty simple. This is when the procedure was done. That is the date of service. So if the procedure that is performed, or basically the procedure code is suppose some medicine or some drug procedure, like some medicines were administered to the patient, then in that case, in alliance segment in loop 2400, the national drug code is required. And guys, national drug code is basically code for that particular medicine. So the national drug code is, I won't say it is the unique identifier for that medicine, because the unique identifier is the RX norm code. I will do a video on this, what is the difference between NDC and RX norm. But for now, just remember, the drug code basically shows the content of the drug, uh, its form, like it's a tablet or it's a syrup, and it shows the strength. So suppose paracetamol 50 mg tablet, so that will have one unique RX norm code, but NDC codes will vary depending only one thing, depending on the producer of the medicine. So if uh, if Cipla produces this medication, same medication, paracetamol tablet 50 mg, they will have one drug code for that. But another pharma company, maybe Glenmark, if they produce that, they will have another NDC code. However, RX norm means normalized form of the code. So basically, what they do is, no matter who has produced the medicine, it is independent of the manufacturer of the medicine. So RX norm will be one, but NDC may vary. Okay, so just keep that in mind. And NDC is always in 542 format. So example, uh, it will be like, if you see it on the packet, it will be like 12345 dash 1234 dash 12. Okay, it will be like this. Now, just want to clarify something, because I have come across this situation a lot of time. So sometimes if the drug code is like this on the packet, 2345 1234 12, but remember the format is always 542. So while sending this to the payer, I will just append a 0 in front of where the format is missing. So in this case, our first was, our first part of the drug code was 4 in length. I want to make it 5 in length, so I'll append a 0 here. But in similar situation, if it was like this, 0 2 3 4 5 2 3 4 12. Now in this case, the middle part is missing one digit, so I'll just add a 0 here, and while sending the drug code on the claim, it will be like this. So I hope that is clear. Alright guys, so that's all about the service line information, and we also went through the 2410, which is align segment, which I spoke about, the NDC code, drug identification. Now in our next video, we are almost towards the end of this EDI series. So only last part remaining is the payment information that goes out on the claim. So when you're sending the claim to the secondary insurance needs to know what primary insurance has paid, so that they can pay accordingly. So in our next video, we will cover that information. Until then, stay tuned and have a good day. Bye bye.